Well, good afternoon, everybody. This is Armin Weinberg. I'm hopeful that everybody can hear me, and I think we are going to get started. We appreciate everybody who's been able to join us. Um, this is our Sea Change messaging webinar, and the purpose of today's presentation is to formally introduce you to the Disparities messages, provide an overview of the process used to develop the messages, and provide you with some examples of how the messages can be used. Today's presentation will be interactive, and we encourage you to participate in the polls and provide input. Lastly, we will have time for question and answers, discussion after the presentation, so we ask you to please take notes throughout, save them. There also, I believe, Brian, isn't there the ability for people to type in questions as well, or not?
Yes, there is. At the bottom right hand, you'll be able to type in your questions, and we can get to those during the question and answer session.
Great, thank you very much. Well, I'm going to again close this welcome just very briefly on behalf of Harold Friedman and myself. We really do appreciate all the attendance, and we really appreciate the good hard work that Tasha and Brian have done to get us to this point. So I'm going to turn it over right now to Tasha.
Thanks, Armin, and thanks everybody again for joining. We're going to start by launching a poll, and the first poll question is, we want to ask you if you have viewed the Disparities Messages and Tips document on the Sea Change website. Again, this was a document that was sent to you and the message, the updates message, so we just want to get a quick sense to see whether or not you've had a chance to review it.
So what we should do is we should put our answer on the screen, huh?
Yep. So we'll give people a minute to select an answer. Okay. All right, we'll go ahead and close the poll. Great. Thank you, guys. We're going to have 2 more polls throughout the webinar or at different points, so we encourage you to participate. This will be helpful to me, again, in follow-up. So, again, when we launch the next poll, be sure to participate because the information will be helpful later. I'm going to turn it back over to Armin, who is going to walk through quickly the background of the Disparities messaging and the background of the Disparities initiative as a whole. I understand that some people may be familiar, but we have some people joining us that may not be familiar as to why Sea Change got involved in Disparities in the first place. So I'm going to provide you with a quick overview and some context that will be helpful as we begin to talk about the messages. Armin?
Thank you, Tasha. For those who are familiar, again, we will commit to making this brief, but hopefully we'll provide the context for the rest of our discussion this afternoon. And for those that are new to this, if it is too brief and you would like to get further information or background, Tasha or myself, but certainly or Harold would be happy to talk to you individually if that would be helpful to you getting further engaged with us in this messaging effort. Having said that, Sea Change has started many years ago as actually the National Dialogue on Cancer. And from the very beginning, part of the equation in that dialogue before we became officially Sea Change was the interest and need to address the health disparities in cancer in particular. And there were many parts of our work that really tried to address this in the efforts that we were conducting. But really, we really had come to the understanding that while we have done that, we really wanted to try and make this one of the key areas going forward, sort of one of the pillars, if you will, of Sea Change moving forward after we took a serious look at the opportunities for the whole organization to make a difference in the cancer arena. So basically prior to 2008, what we had is an effort where we recognized the importance, we made sure we had engagement of individuals and organizations that were addressing health disparities in cancer. But in 2008, we made a specific concrete decision to convene a group of our leaders and really talk about what sea change could do that would be unique in this arena. And, you know, the group that came together reviewed, as you might imagine, the work that we had done individually as leaders, groups, and organizations. We looked at some of the progress and lack of progress in these areas. And what Sea Change had done is, as you may recall, is really provide one of the first efforts really to significantly bring the sectors together, the public, private, and nonprofit sectors together. And in doing this, we also made a commitment as an organization that we really didn't want to obviously compete with any other existing organizations in what was being done, but rather enhance what we were doing. And that's why when we came up with the name Sea Change, by the way, the tag to that is collaborating, to conquer. And the first thing we would do, as most good organizations would look at, we thought, let's make a commission. That is, that we had found in some of the other areas that we had worked on together in Sea Change, we found that creation of a case statement or a business case basically for addressing one of these major areas of concern, where we thought we could get the multi-sector engagement of our organizations and leaders to really take hold. So we basically followed our model that we had used in other Sea Change areas and created this opportunity to get the traction through this kind of approach. So we set the goal for this to basically, for our work together to, again, as you see on this slide, create traction among the general public and policymakers, inciting action to eliminate cancer health disparities. Now, that case statement really, again, helped us because what it did, and I'll go on to the next slide, that case statement, as you can see, was the top of the list of these elements of our initiative. It basically provided us an opportunity to look at the varied things that we could do. We know that we need to talk to people and stakeholders and leaders. We also know that we needed some evidence and data. The Susan G. Komen Foundation supported the creation of that case statement, by the way, and it's available if you haven't seen it. It's a very good report that is available as part of this effort. But basically what that case statement did, however, was it showed us that we needed to do more. I think as a group we decided we needed to do more with this than just have messages. The messages are a part of it. We needed to have messages that really would appeal to the different elements of our organization, but also would help us in communicating to other stakeholders. We're going to spend a lot of time on that today, the rest of the session, but I wanted to give you just a quick sense of that because the messages that we have developed in other areas of the Sea Change work really do help. It gives us the ability to be somewhat directly, if you will, clear on what the issues are. In the area that our case statement worked on, we learned that we had a couple of different messages in a couple of different audiences, and that's why we really needed to take some time and develop these a little further, and you're going to hear again some more of that. The other part of what we decided as a result of that 2008 initiative was Dr. Friedman in snowy New York one day was working with Tasha and myself. We were trying to think of some of the feedback that we had gotten, what we might do, and really we identified as a part of this, based on Harold's previous work, that maybe we should try and do a geographic intervention project, as we've come to call it. And that really, a lot of that was based on the success that Harold had in terms of the patient navigation effort, where identifying a population that seemed to have a different outcome than one should expect, could be addressed by having, some change to the system, and that's where the patient navigator, of course, concept and reality really started to really bear fruit. Well, I think Harold, when we met, and Tasha can chime in, but when we met, the opportunity for us to do something similar with the efforts of our collaboration through Sea Change really took hold. So that has been the basis of our doing what we call, in addition to the message component, a geographic intervention project. And we will be doing more on that in the coming months. But basically what we have done there is we've identified the opportunity to take a community that we can try again and draw on the resources of the organizations and partners to make a difference in that community or communities. The third thing is, as a part of this effort, we agreed that what we would do is we would really focus on something that we knew was happening as a part of the initiatives from the Department of Health and Human Services, and especially coming from the Office of Minority Health, which was the program called the National Partnership for Action to End Health Disparities, sometimes referred to as the NPA. And this is a program that, for those who are not familiar with it, again, is really worth looking at, because what it did is it established a very good program of regional efforts and leadership to really draw on resources, not just in the Tampa area, but across the board. And it's very appropriate because of the time, again, that we find ourselves in with the implementation of the Affordable Care Act. If we can go to the next slide, Tasha. So if you look at these, again, efforts in sort of the broad base, and I've touched on this a little bit already, but really we want to make sure that what we do continues to take advantage of the uniqueness of Sea Change as an organization and of our members who wish to collaborate in this effort. We're excited about it because in what we now have in front of us, we think we have two very concrete examples of what we can do together to help address disparities which unfortunately do remain. We think we can do it by speaking with one voice. And by the way, that's a tagline we had from the Intercultural Cancer Council many years ago, was the speaking with one voice. And I think it's very true. If we can get those messages, we can do this more effectively than if we do it individually. So I mean, if we have the same messages that we can carry forward to our various organizations and communities and get to the leaders, stakeholders, we will, I think, have some traction. There's been some concern about that over the years that we've not been able to do that. And I think with our help, Sea Change has done a good job of providing that to us with these messages. The second thing is I think we'll be able to leverage our unique capacity. Again, we certainly know that if we can do this, we will be able to, with that geographic intervention initiative, and frankly, even those of us who have other activities with these messages and our own work, we'll be able to have more successful, I think, interventions that really do lead to reducing health disparities. I can say from both the Intercultural Cancer Council, my perspective in that organization, as well as our Life Beyond Cancer Foundation, I can see how taking these messages will be helpful to us in communicating with our network around the country to get this acted upon. So I'm hoping that this will really set the stage. I hope that gives you enough of an overview to let us get to this point where I'm going to turn it back to Tasha. And I think I did that in the allotted 10 minutes. And then we can carry on. And again, I know that Harold and I would both be happy if there's additional background that you would like to hear from us. We'd be happy to share that with you as well. Tasha?
Thanks, Armin. So I'm going to walk you through the messages and the process that we used to develop the messages. So the messages were based on the case statement, as Armin mentioned, as well as other national guidance documents and research. And we wanted to develop a comprehensive communications plan to incite action and spark a national conversation. So these messages are gripping and evidence-based. They are customizable, and they're for your use. So we definitely want you to use them and incorporate them into your organization's communications. So we had to start by reframing the problem. And so we looked at national disparities reports, again, the case statement, and the Robert Wood Johnson Foundation guidance document, A New Way to Talk About the Social Determinants of Health. The process that we used included focus groups, one-on-one interviews, deep dive interviews, informal interviews, and a survey to the Sea Change membership. We did the focus groups and interviews at national conferences, the ASCO conference, the American Society of Clinical Oncology, as well as the ICC Biennial Conference. And I just want to talk a little bit about the different styles of interviews. Focus groups, again, took place with a group of individuals, and we had a range of, we made sure we got a range of individuals from different organizations, not-for-profit, government, and private sector. For the interviews, we also made sure that we got a range of opinions, and we employed different styles. So for the deep dive interviews, that's where we sat down one-on-one with individuals and actually delved into, what are your personal thoughts around certain topic areas of disparities. For the informal interviews, those were just us stopping individuals as they were walking out of a conference room or a main session and asking, hey, we have a question about this. Can we get your opinion real quick? And then the other interviews, the one-on-one interviews, were similar to the deep dives, but we limited our questions with those interviews, and we only stuck to a certain amount of questions, and it wasn't as long as the deep dive interviews. The key takeaways from all of this was that, one, we need to clearly define disparities beyond race and ethnicity. Two, use empowerment language. Empowerment language performed well over all and across all of the groups that we interviewed and spoke with. We need to explain why we chose certain words. Words like choices and opportunity and unequal are received differently by different audiences. And lastly, we needed to segment messages by audience. What is best for policymakers to hear, to compel them to action, is not the same as for the general public. So framing the message. I'm now going to walk you through the message frames, the main message frames. The first one is where health starts. And this message was created to help foster dialogues with individuals not familiar with the concept. We created a frame around health based on research into what policymakers and the public respond to best. We describe the problem, and it serves as priming language to help messengers move to a more nuanced discussion of disparities and the calls to action we seek. Where health starts. In all of the focus groups and all the interviews we had, one thing that was certain is that people believe that health starts long before a person gets sick. So this is something, important to start off with, because one, health disparities is not just about race and ethnicity. And so the neighborhood you live in, the community you're in, even the person you're born to and how healthy they were, all of those take a factor in your health. And so it's important to know that disparities is not just about a race and ethnicity, rather it starts far beyond that, and it's inclusive of everything beyond what genetics would explain. Educated choices. The language on here is simple, and it's focused on prevention. In fact, we have a prevention initiative, and this language is actually the same language that we're using with our prevention messaging. It's important not to overwhelm a new audience with new statistics when introducing the concept of disparities. Don't throw a whole bunch of numbers at them, especially if this is something that they're not interested in or they haven't taken an interest in, and this may be their first, entry into the disparities arena. So keep it simple. Central to the idea of disparities is the idea that certain factors contributing to cancer can be prevented. So this statistic, half of all cancer cases can be traced back to preventable factors. It serves this role. Another thing about educated choices, back in 2011 at our annual meeting, when we first presented the concept of developing these messages and having a position statement, one word that kept coming up and throughout the Sea Change membership and in conversation was that we need to include the word educated and education. So this is reflective of us taking into account the opinions and the advice of our members. Fixing healthcare where it starts. This is, again, central to the first frame. Radical terms not used because disparities exist across socioeconomic, race, and ethnic boundaries. The Robert Wood Johnson research indicated that leading with explicit talk about race caused some participants to be less open to subsequent messages. It's a turnoff. Reason for the prevalence is important to prime skeptical audiences to accept why disparities exist and understand the problem's origin. The last sentence in this frame was high performing with the Robert Wood Johnson Foundation research as well. So again, we're trying to invite these individuals that may not be aware of disparities or may not think it's their problem. We're trying to invite them into a conversation, into a dialogue, and so we don't want to turn them off. So keeping to the point that disparities is something that everyone can be affected by is what we want to focus on. Within our power. This is empowering language that I referenced earlier. Empowerment language is motivating and serves as a bridge to the call to actions. This is something that we can do. It's within our power to create better screening and programs and research and prevention. We can tackle this, and it puts the onus of it into the hands of who you're talking to. So now we're going to launch our second poll. And so the question is, after reviewing these message frames, how satisfied are you with the final messages? We want your honest opinion. And again, they're on our website, so you'll have more time to look at them. But just based on the brief information that you received and what you saw, just quickly let us know what your thoughts are. Okay, thank you very much. We can close the poll now. Interesting, and so you all should be able to see what your peers thought or what your peers' thoughts are too. Okay, so I'm going to move on to what you can do because again, we want to empower you guys to take action and use these messages. So we want you to work with your organization to incorporate these messages into its communications. How do you do that? Well, your staff newsletters. If your organization has an internal newsletter, use the messages in the wording. Also on your website, if your organization already has a disparities section on its website, already uses disparities materials, tweaking the language to reflect the disparities messages is something you can easily do. As well as if you have a conference, if there's a conference that is going to be on disparities or disparities topic, incorporate the language. It's within your power. It's something we can do. Half all cancer cases can be prevented. Educated choices, along with pamphlets, handouts that you may give to the community. Again, this is something we want you to incorporate into things you're already doing. Don't want to reinvent the wheel. We don't want you to have to create new materials, rather just tweaking the language of materials that you already have. Again, it's so important for us to speak with one voice, and if people see the same messages over and over again, it's more than likely to stick. We also want you to use the messages and your advocacy opportunities. How can you do that? So for Hill Days, when you're going to speak with your legislators or you have your advocates speaking with your legislators, arm them with the disparities fact sheet that we created and change the messages, tweak it to fit your organization. Throw your organization's logo on there. It's an easy one-page fact sheet front and back that can be taken anywhere and just pulled out, and it has facts on it. It also has the messages, and again, it's customizable. Letters to editor, op-ed pieces. included with the messaging materials on our website, there are templates that can be customized again to fit your organization's needs. If you have a physician at your organization or another notable figure that's going on the radio or on television, and you know who their speechwriter is, or you're actually developing the language they're going to use in that conversation, incorporate some of the messages and some of the terms that are used in the messages we developed. Again, like I mentioned, the tools are available to download on the SeaChange website. The link is right there. There's a one-page front and back overview sheet, the Communicating About Cancer Health Disparities Messages and Tips Guide, a letter to the editor template, and the op-ed template. All of them can be downloaded and easily customizable, and again, I am more than happy to work with you one-on-one to help you find ways in which you can incorporate these messages into your organization's communications. I want to now stop there and open the lines up. You guys have been muted, and we're going to unmute everyone to give you a chance to provide some thoughts, have a discussion, and ask some questions that you may have. Does anyone have a question or a thought? Okay, I'm going to take that as
Tasha, can you hear me?
I can hear you, Armin.
Oh, good. Well, I was just thinking before too long, since I didn't have a chance, but Dr. Friedman is on now. I didn't know if maybe he had a couple of thoughts or comments he'd like to make.
Things going along very well.
I think Dr. Freeman may be having some technical difficulties.
Okay, sorry about that. Okay. Is it possible for you to pull up the website where exactly where we would find these on our website? Or
At this time I can't, but I can, again, I'm more than happy to work with anyone one-on-one, and we can schedule another time to walk through the materials on the website. If someone would like to do that, they can just email me.
I don't know whether Brian could do it or not, but okay.
You can pull that up, Tasha, if you want. You can just pull up a web browser, Tasha, and you can pull it up.
Okay.
Yeah. I have mine up if you want to.
I'm not sure.
You want to walk me through exactly where to go. You could make me the presenter for a second. And I think it's always nice to actually see where they're at on the websites.
Okay.
So,
alrighty. So on the SeaChange website, you guys should be able to see my screen. We revamped the website, hopefully to make it more easily to navigate. If you click on my name under staff contact, it'll take you right to my email address. And here is where we list the disparities messages and tools. The message frames are right here. You can click on and download a copy of the case statement right here. These are the main message frames. And if you wanted more information on where we got our rationale for the frames from the Robert Wood Johnson Foundation report, they're listed or referenced right here. We also talk about, for those interested, our geographic intervention project. And the website for the HHS National Partnership to End Disparities, the direct link is listed on our website as well. If you want to download the messages and the tips, you click here, and you're taken right to them. Okay?
Great.
So it's pretty easy to find and access, and all, again, downloadable and customizable.
So that's very helpful, Gosh. I'm glad you were able to show us that. I have one last question myself, and maybe others again have others, but how can we attribute, if we take those messages and adapt them in any way, shape, or form, what kind of acknowledgement should we provide to sea change, and how do we do that? Is there anything you want us to do?
No, there is no need to acknowledge sea change. Again, we want you to take these messages and make them your own. Sea change is its members. So we don't seek to get publicity for the stuff we do. Everything we create is for our members. And by you speaking and using your organization, especially if your organization already has a brand and they're seeing it come from your organization and several other organizations that are also already recognizable and already noticeable, that does nothing but help the cause. Again, the whole point of this is that we're speaking with one voice and that we're all communicating the same message to all segments of our population. We want people to get this, and the only way they're going to get it is to repeatedly hear it and repeatedly hear the same message.
Great, thank you. It's okay if we give you a little credit, though.
Oh, well, we never mind any credit. Definitely, that's always fine. However, again, if your organization already has a brand and it's a well-known, noticeable brand, we encourage you to, make the materials your own. If you want to reference sea change via logo or you want specific language, you can definitely contact me and I can provide that for you.
That's great. Well, thank you. That's very good. I see Dr. Friedman's trying to fix the problem on his end. So I don't know if he's successful or not.
I don't think he's been successful yet.
Sometimes what happens on these systems is you have a telephone call and a microphone. That's what I've learned. It's better to have one or the other, but not both.
Yes, definitely. Okay, we're going to move on to the last poll. Okay, so if you can quickly just provide your response. We want to know how likely you / your organization will be to adopt and encourage your organization to adopt these disparities messages. Again, we want your honest opinion. This will be helpful for me in my follow-up. Okay, we'll go ahead and close the poll. And you should all be able to see each other's results. Again, we appreciate your honesty, and this is definitely something that I will be referencing in my follow-up to the attendees on this call. Okay. I just want to lastly say thank you for taking the time to participate in this webinar. We are glad that you are interested in the messages. By participating in this webinar, that showed me that you have some type of interest, and we are looking forward to following up with you to find out how we can further work with your organizations to help with bringing these messages to fruition and incorporating them into everyone's communications. Again, please follow up with me offline if you have any questions, and I will be following up with you if you don't. Thank you so much.
Thank you, Tasha.